Welcome back, everyone. My name is Susan Giglio, and we're here to talk about yoga for pelvic health. In our last video, we talked about where the pelvic floor muscles are and how they're situated inside of the bony landmarks of the pelvis. And we talked about breathing and the anatomy or the physiology of breathing as far as the movement of the diaphragm and how it relates to the abdominal muscles and the pelvic floor. So I wanted you to grab your washcloth. We talked about needing a washcloth in the first one, and we didn't actually use it, but we're going to use it now. So if you notice that the folded washcloth is in the shape of a diamond, just like the bones of the pelvis are in the shape of the diamond. So what I want you to invite you to do first is take the washcloth and place it in the area of the pelvic floor. And see if that input from the washcloth helps you with your awareness of the pelvic floor muscles. So in reviewing what we did from the last lecture, we're going to take a breath in. And on the breath out, we're going to gently squeeze and lift the pelvic floor muscles, pulling the tailbone towards the pubic bone, pubic bone towards the tailbone. And then we're going to relax that effort and inhale again. And exhale, squeeze and lift, this time focusing on the sit bones and pulling, finding the muscles that would pull the sit bones together. And then releasing. And then take a finger or two and place it on the pubic bone in front. And take the other hand and place it on the tailbone in the back. And as added input to your nervous system, notice where the fingers are resting. And see when you try to squeeze the muscles, if you can find the muscle that would pull the two sets of fingers towards each other. So take a breath in, breathe out and squeeze. And lift, pulling the fingers of the right hand towards the fingers of the left hand and vice versa. And release as they move further apart. We'll inhale. Exhale, squeeze, and see if you can find that muscle that would pull the two sets of fingers towards each other. And release. And then we're going to take the fingers and place them just inside the sit bone on each side. And then see if you can find the muscle that would pull your fingers together in that direction. So take the breath in, breathe out and squeeze. Notice where the washcloth is still hitting against your perineum. See if you can lift up the center of the washcloth and then release. Try that again, breathe in. Remember the abdominals and the pelvic floor release on the inhale. And they contract on the exhale. So removing your fingers, coming back to just the awareness of where the washcloth is resting up into those pelvic floor muscles, and imagine that you're pulling the four corners of the washcloth towards the center and then lifting. So there's an inhale and an exhale, pull to center and lift. Good. So we're going to remove the washcloth. In yoga we have several different props that we might use. So we might use our folded blanket and rolling it up so that it's more like a sausage, and placing that in the perineal area is another way to feel that area inside the sit bones. So where the rolled blanket fits right inside of the ischial tuberosities of those sit bones would be where your pelvic floor muscles are resting. So you can think about pulling back to front, front to back. Inhale. exhale like you're trying to scrunch up the towel. And then you can think about breathing in, breathing out, and pulling, squeezing the towel with the sit bones without actually moving anything. And so notice that where the towel is resting sort of keeps you from wanting to tighten your buttocks muscle. So there's a breath in, a breath out, a squeeze and lift, but notice that nothing moves. So with a lot of people, in order to isolate the pelvic floor muscle, they try to use their abdominals and they start rocking the pelvis, or they start wanting to squeeze their gluteals or their hamstrings or some other bigger muscle that's easier to access. So just notice your tendency to do that and see if you can come up with ways to isolate the muscle a little bit better. And we just practiced several. One would be putting the washcloth, one would be putting the fingers, and one would be isolating the muscles a little bit better by sitting on a folded blanket. So that's some seated postures. This particular yoga pose is called hero pose, and this is a really nice position to get into if you to practice pelvic floor work. I'm going to take the blanket out now, and the other prop is a block, and this is another way of trying to come into more awareness of the pelvic floor when you're in your yoga practice. So if we sit on something firm like the block, we're going to inhale and exhale and squeeze and lift and then release. And it's almost like you're trying to pull the floor, those pelvic floor muscles away from the hard surface here without squeezing the larger muscles. So removing the block now, I want to talk about your posture. So you've been seeing me from the front so far, but now we're going to sit with my posture to the side. So in this position, I'm going to try to be balanced on my blanket. And again, I've got my blanket underneath my sit bones here in order to help me maintain a little bit of a pelvic tilt, anterior pelvic tilt. And that helps me keep a normal curve in my low back. So without the blanket, my tendency might be to be here. And when we sit in this sort of slouched position, our pelvic floor muscles don't work as well. If we sit with the blanket, we have a better alignment of our abdominals and our pelvic floor. And when a muscle is at its desired length, then it makes it easier for it to contract. Now, if I go a little bit further and sit really tall in my seat, and this axial extension of drawing the top of the head up, that has actually been shown to engage the pelvic floor muscles even more than just erect sitting. So, if you think about your posture and just seated at your desk, if you sit in a better posture, then you're going to be naturally able to engage the pelvic floor muscles a little bit better. So that would be sitting in a yoga class. Again, a block is a good option when you go to yoga class. So a block also gets you up a little bit higher. And here I'm able to really allow my knees to drop down, pretty much lower than my hips, and maintain that anterior tilt. The alignment of the pelvis and the diaphragm is very important too, because we want to have the rib cage right over the pelvis in order for those muscles to work the way we talked about in the last session, where they have a pistoning movement of a downward of the diaphragm, downward of the pelvic floor, upward movement of the diaphragm, upward movement of the pelvic floor. And they do this little dance back and forth when we do our intentional breathing. So moving on to the next posture, if we get into a hands and knees position, We also want to think about how we can get in this position and engage our pelvic floor muscles. So we want to look at a neutral spine position where there's a little bit of an anterior tilt. We want to make sure that our joints are stacked so that the wrists and the elbows and the shoulders are all right on top of each other. The knees are under the hips, and there's a little bit of a drawing up of the tailbone towards the ceiling. And one of my favorite exercises to do as we start to kind of get to know the pelvic floor is to keep that neutral alignment as we inhale and come back, and exhale as we come forward. And so if you're on your mat right now, go ahead and work with me on an inhale, move back. And on the exhale, gently squeeze your pelvic floor and move forward. And then inhale, move back. Notice, if you will, that as you move back, if your tailbone is drawing up towards the ceiling, that your sit bones will gently move out to the side. And to enhance that, if you take your feet out to the sides of the yoga mat and come back, you won't come back as far because your hips are now in a pretty extreme internally rotated position, but it will help to enhance that sensation of your sit bones moving apart and your tailbone drawing up. So we're going to do this a couple of times now. So inhale back. Squeeze your pelvic floor, exhale, come forward. Inhale, come back. Squeeze your pelvic floor, exhale, come forward. I'm going to go one more time. Inhale. Squeeze your pelvic floor. And come forward. And then coming back to sit on the heels, if that's comfortable for your knees. See if you can place your heels inside towards the inner part of the sit bones, the inner part of the upper thighs, and then allow your heels to sort of relax and roll out just a bit. And when you do that, you'll be also giving some input to your nervous system about where the pelvic floor is. You'll be able to maintain your posture here in this more erect, anteriorly tilted position, and it really helps to feel where the pelvic floor muscles are. So take a moment now to breathe in and breathe out and squeeze and lift the pelvic floor. So we're going to come back into our all fours position. This time take your hands a little bit further in front of the shoulders. We're going to move from this position into a plank. I call this a plank progression. So from here, you're going to inhale back, keeping the sit bones moving apart, and you're going to exhale, squeeze the pelvic floor, and come forward so that you're working on the layering of the bigger abdominal muscles on top of the pelvic floor muscles. So you inhale back, squeeze, exhale, maintaining the squeeze of the pelvic floor as you come forward. And inhale, and squeeze, and exhale. Now, those of you who are ready for the next level, keep the pelvic floor tight, tuck the toes under, and lift your knees. And now you've got a plank. Drop the knees, put down, and come back. Child's pose is a nice rest position after these postures. Child's pose is also an excellent position to practice your breathing. You can do a narrow child's pose. You can do the child's pose with your knees apart, and they will have different sensations in your body. So I invite you to get into a child's pose right now. First with your knees together, feet together. Arms can be extended like mine just were towards the end of the mat here, or you can bring them back around so that they're close to your feet. And when you breathe in this way and your legs are blocking the abdominals, you'll feel a lot more movement in the back of the rib cage, and you'll feel a lot more movement down into the pelvic floor. So spend a moment just to get in that position and practice your breathing. And then take your knees just a little bit wider. So now you're not blocking your belly nearly as much. And notice the difference. Where does the breath go? Where do you feel resistance to the breath? Are there any muscles that you're currently tightening that could be allowed to release in order to get the breath to be smoother, seamless? Remember, the whole goal of yoga as a moving meditation is to combine movements with breathing and to combine the awareness and the attention of the mind on these movements of the body, the simplest of which is breathing. Thank you for your time. I'll see you back here for the next session. Namaste.